this and that and this and that. And if they tell me they're a diabetic, I often have to catch myself because sometimes they'll say, oh, good. And I go apologize. But I can tell you a little bit about my past. I was a general surgeon at the University of North Carolina in Chapel Hill for 20 years. And so I did kind of regular general surgical procedures, which is removing gallbladders and hernias, taking care of people for breast cancer, colon cancer, and I also took care of trauma patients, so people with gunshot wounds and car wrecks and things. But one of the things as a general surgeon you're often called upon is a diabetic who gets an infection in their foot can go on to gangrene and ultimately, in the worst cases, go on to amputation. And as a little surgeon, just growing up, I got used to a lot of things. Like you have to get used to making a cut in the skin and seeing blood. And, sometimes if there's an infection, smelly things or, stuff that's not that great. But I never got used to amputation. I mean, it's a really barbaric, rough, tough thing to think about and to do. And when I think about now that I sometimes help diabetics not be diabetic anymore, it's one of the most rewarding things that I think I get to do. So, because diabetes is kind of rough business.